Um, when I first discovered that I had cancer, it was just mere accident. I went to bed, lie down, and I was moisturizing and I found a lump. And then I went and speak with my doctor. My doctor sent me to the breast unit where I did a mammogram, and then I had to do an ultrasound, and then had to do a biopsy, which confirmed the cancer stage 3 herceptin. You know, I felt like my world came crashing down. I didn't have any feelings. I felt like the world, the hurt was gonna swallow me up, and I didn't want to hear. I didn't, because I thought I was gonna die. But then I went to my consultant, and she talked to me about what's gonna happen and when it's gonna happen, which everything happened within 3 weeks. I had the operation, and after the operation I was in hospital for 3 days, and then I came out, and then I had my wound to attend to, which nurses come out and dress it and everything. And then I've got people like from Macmillan support, cancer support, come out and talk to me and tell me what's to expect, and if I'm feeling any way that I can get counseling and all that. And it was daunting at first. I felt afraid. I felt frightened. I thought I was gonna die, leaving my children. So I wanted to fight. I had to fight. So to for survival, to stay alive, because I've never had experience. I don't know anybody who had cancer before. So for me, it was really frightening, scary. But because I had people around, I was signposted to people who's been through it, who's going through it, and is in it. So that helping me, lots and lots of information out there. There's lots of information. Check your body. Make sure if anything doesn't feel right in your breast area, then seek medical help. Make sure that they don't stop until you get the result that you need. All right, because sometimes they'll fob you off, but don't be fobbed off. You have to persistent. I was persistent. Had I not been persistent, maybe I wouldn't be here. That was 2015, my first cancer. And I had to have, when they tell me I had to have chemotherapy and radiotherapy, chemotherapy where I lost my hair, and that was frightening. That was daunting. I didn't want to go outside. I didn't want to see nobody at first. And and my world became dark, and lonesome, because I felt I couldn't tell my family what was going through me really. And, things were happening, and the chemo was hard. It was painful. It really, I had like 12 days of intense chemotherapy. And it was no, actually I had about 3 months of it, and it was really, really tough. But I survived it. I was bald head. I had to wear scarf and wigs and stuff. And you know what? And walking around with one boobies, you felt you conscious. It was conscious, so I had to wear scarf so people don't see, and I stay away from going out. But with getting the right support and help, it helped me to be more, just comfortable with my body, with myself. And then I had a radiotherapy, which was hard, as again, it was really hard, but that was easier than the chemotherapy. And then I was put on tamoxifen. Then I went on to letrozole, and that supposed to be for that supposed to be for 10 years, but unfortunately 2 years later the cancer came back in my other breast, in my duct. And because I knew about the first one and how the treatment and everything, it wasn't as daunting as the first one, because I was much comfortable. I had all the information that I needed from the first one, so I knew what to expect, and I knew there was people out there I could talk to, and people out there that's going through it worse than me, like me, and not so much. But there's always somebody to talk to. Macmillan 1-to-1 and cancer support helped me a lot to deal with my emotion, my feelings, my everything. They're there to help you with your finance, everything that you're struggling with. They're there to help you with, and they can help you with it. That was 2017 was my second breast cancer. 2019 my cancer came back in my breast, in my same right side, which again, it was sheer luck I found it, and because of my past experience, they were able to help me and direct me to the right people to go to, and had it done within 3 weeks. Yes, so I had 2 mastectomy, and then I had a wall clearance, the same breast side, But people who's going through it, there is help out there. There's signposts, people. Check your body. Check your body. Constant check and make sure you know. But not least, check and make sure that if you see any signs of abnormality, go and seek medical help before it is too late. Because if you leave it too late, like my auntie did, she died last year, because she left it too late. And then when she found out, she did nothing about it. She hid it. So because of that, within a year of the family knowing, actually within 3 months of the family knowing, she passed. So I'm saying, you can have your nipple normally out and then it's going, check it. There's milk or something coming out, check it. There is spots on your, check it. Bruises, whatever it is, lumps, check it. Make sure you get the right advice and the right, before it is too late, because that's why I'm here. And I'm here to tell people and encourage people, how to deal with cancer.